Okay, so this is part 2 of things that could be going on with the way that you're moving if your more affected leg, so if this is my more affected leg, rotates out when you're walking. So in another video, I talked about how there can be issues at your foot and your ankle that could be contributing to this. Another piece is when we're walking forward, we have our hips and like where our pockets would be in our pants stays facing relatively forward. There's a little bit of rotation, not a ton, if we're just walking straight ahead. So if I take a step with my less affected and I end up twisting my body or rotating this lower part of my body, which is my pelvis, okay, in this direction, that can encourage your leg to be rotated out and for you to pull through with this strong inner thigh muscle. And then you, again, if your leg gets rotated out once you get started, it's challenging to bring it back into the like normal alignment and orientation that you're wanting. So another thing to pay attention to is, you want to keep your pockets facing the direction you want to go when you're walking forward. So if I support on this leg, if I take a step with this leg, my pockets are still forward. In this position, if you find that your pockets are rotating toward that leg, a lot of times it's because you're tight in through here, tight in through your hip, okay? So I'm going to exaggerate. If I were tight here and I go to take a step and I can't get stretched out, what your body will do is say, oh, we can create a little bit of range of motion like this, and then bring your leg through, okay? So you want to be able to get your thigh behind your pocket pretty easily to have that range of motion. And I'll share with you a way you can check that out and a couple of variations to stretch that. So if you find that that is the reason why you rotate, sometimes it's because you don't keep yourself tucked in with your fanny, with your pockets moving in this direction. You might, let me see if I can, so this is my more affected leg. So if I stand on it and I go to step this one, if I'm a little weak, I might fold and rotate this way a little bit so that when I go to stand on this one, my leg would turn. All right? So leaning heavily on a one-sided device, a cane, a hemi walker, kind of tends to get you turning this off and not really supporting on that leg. So looking into the range of motion in the front part of your hip and the strength and control to come up on that hip or up on that leg are two things to look at that could also be contributing to a leg that rotates out when you're walking. Okay, so I want to share with you a way to check to see if the front of your hip is tight, and then share with you also things that you can do to help get that stretched out. So times that would be a problem is if I'm tight in the front of my hip and I go to take a step. To really be able to come through, I need range of motion here. If I don't have it, my leg and my pelvis might end up rotating this way, and my leg would come through rotated, so turned out to the side, okay? Another piece is that you might have difficulty really getting tall up onto that leg to be able to take a step to work on your balance. And if you're going to be strengthening this, you want to have enough range of motion in the front. So this is a test that I would do with a client in therapy. And so you can get some help with this one. So you want to be sitting on the edge of a surface. You could sit on the side of a bed to do it and lie back. My particular mat is just too narrow to do it that way. So I'm going to be on the end. And so we're going to look at my more affected leg. So when I do this with folks, I help them lie back and I have them draw their less affected leg up. And then you can reach behind your thigh to gently hold this in. And then what you're going to do is let your more affected leg rest down. So 2 things. Having this knee in is going to help protect your back, and it's going to put this area on the maximum stretch. What you would like to see is that your thigh rests on the surface and that your knee gently bends. Now, for this particular setup, I'll show you, if you look at how, if I pull back, that's like the max amount of stretch I can get. So if I switch, and I look at the other side, I let it rest. So I'm actually tighter on this side. My thigh's not touching the surface, and I can't really pull back, okay? So I need a little bit of work there. But what you could do is compare your more affected side to your less affected side. And for many people, when your less affected side comes down, you may find that your leg doesn't get even close to the surface and that your knee is straight. And so working on this range of motion can help with knee bending when you're walking also. Help you get up tall onto this leg and be able to transition over it. So you could use this position as an actual stretch if you felt like you could manage it. So you may be in this position, and then what you could do is put this foot down and bring this one up. And if you need to get a hold of your britches, you could pull up to help there. And again, bring this one in, and then if you're able, drop that one down and let it rest. And in this position, 30 seconds, a minute, as long as it takes for this to let go. An easier way to do it is also to be maybe at the edge of your bed, but I'm going to have my hips closer and my shoulders more toward the middle, so I don't feel like I'm going to roll off the side. And then you can let that leg drop down. Again, we're looking for your thigh to move toward the floor and your knee to gently bend, not to be stuck out straight. So you're just going to be here and just try to let that leg just be as heavy as it can. We're going to keep the other leg bent up to help protect our back a little bit.